In this video, we're going to talk about how to get started on your research for your health policy assignment. So we're going to start at the Nursing 336 course guide. So this should be linked in your Moodle page, and you can also go to this address or search for it on the library website. So anytime that you're doing research on a topic that you're not very familiar with, it can be really helpful to do some background reading to get a better understanding of your topic before you try to dive in. If you try to go directly to searching for journal articles, then it might be a little bit difficult. First of all, you might have trouble finding journal articles that are relevant because you might not know which words to search for. It might also be difficult for you to understand the journal articles because journal articles tend to take a deep dive into particular aspects of a topic rather than providing an overview of a topic. So if you're not familiar with that topic, then you might have a really hard time following what they're talking about. So it's a good idea to do some background research first. So this is kind of the process that you might follow when you're doing research. Sometimes students expect research to be kind of a linear, quick process, and then they start to panic a little bit if they have to take a step back. They feel like they're starting over with their research. So it helps to know a little bit about the nature of research before you jump in. So it really is more of a cyclical process than a linear process. So the first thing you want to do anytime you're getting started with research is read as much as you can about your topic. Try to get a sense of what's happening with your topic, what are the big things that people are talking about right now, what's the history, what's the context. And as you go, you want to make a list of the key words and phrases that you see popping up over and over. So especially when you're looking at policy information, if you see the names of particular policies or policy makers coming up a lot, then you want to add those to your list because then you can do a search for these new words or for the names of those policies so you can find more information. And then you'll read that more information and you might find more words and phrases or names to add to your list. And then you can do another search for that and read everything that you find. So as long as you feel like you're getting a better understanding of your topic, it's okay if you feel like you're circling a little bit because that's just the nature of learning about something that you're not familiar with. So what does this actually look like in practice? So there are a few different places here where you can get started to find some information about your health policy topics. If you're looking at a Boston community, this Health of Boston report that comes out every 2 years is a really great place to start. It goes into healthcare information on lots of different topics, lots of different indicators of health, and there's some information broken down by neighborhood. So if you're looking at Boston, this can be a really good place to start. If you want to look at something different, or if you're not working with Boston, then one of these other websites might be a good place to get started where you can find just some general information about your topic. So we're going to take a quick look at Healthy People 2020, which will soon become Healthy People 2030 as we move closer toward 2020. So this is a national initiative that focuses on key areas of health for the US population. So let's say that I'm really interested in finding information about childbirth outcomes for African American women in the United States. So I'm just going to do a quick search for childbirth, start very broad and see where we end up. Let's see. Okay, maternal, infant, and child health. That sounds promising. So here you'll find an overview of maternal, infant, and child health in the United States. So one of the first things that's mentioned is that there are racial and ethnic disparities for mothers and children In particular, maternal and infant mortality and morbidity are highest for African Americans, and these differences are likely a result of many factors. So this is something that we might want to take a look at if this is our topic. So one thing that we'll definitely want to do is add words like maternal mortality or infant mortality to our list of terms if that's something that we want to learn more about, because I might not have thought to search for maternal mortality beforehand. Another thing that we can do is look at these references, because there might be articles or reports that this overview is citing that are really relevant. So then I can go find those sources and read those, and maybe those will even lead you to other references. So this is a really good way of kind of following the references and finding more information. So this is a very quick overview, but it gives you an example of how you might get started when you're not really sure how to start.